So, how often do you see children with cerebral palsy in your OPD?
Every day. The youngest child I had in my career so far has been 52-day-old child, and the oldest one was 29-year-old adult. Children have an issue, parents are not aware of it, the doctors whom they're going to, they are not aware of it, they keep waiting. The main purpose is that because these children can be brought back, not 100%, but to a large extent.
Yeah.
If things can be. Hello, Namaste, Salam Alaikum, Sat Sri Akal. Dr. Naeem Sadiq, neurologist, neuropsychiatrist, founder and director of Plexus Neuro and Stem Cell Research Center.
Welcome to the Dr. Brain STEM podcast, your portal to understanding the complexities of neurological disorders. Today, in part 1 of the podcast with Plexus, we delve into the topic of cerebral palsy, the early signs, symptoms, and diagnosis. Together, we're committed to raising awareness, enhancing knowledge, and exploring how this condition affects the daily lives of patients and their families. Guiding us through today's discussion is Ms. Kanishka, a seasoned occupational therapist with a master's in occupational therapy and the head of the Department of Rehabilitation.
Hi, good morning, Dr. Naeem. How are you doing today?
Good morning, great, awesome. How are you?
I'm good, as usual. So, we have received an overwhelming response to our last two podcasts. We spoke about autism spectrum disorders and a lot about ADHD. And because of that, we have decided to do another episode. And this time on another neurological disorder in children, which is now a motor disorder, cerebral palsy.
Yeah.
So, CP, what do you want to tell us about cerebral palsy? What is CP?
Right, yeah. Now, CP is, if we are going to talk in continuation in what we had done earlier, and it is a group of disorders where the children have difficulty in maintaining posture, maintaining balance, and motor control, which is contrary to what we had discussed in the previous podcast, and a lot of people get confused with these two. Cerebral palsy is specifically disorder of motor functioning, where strength, balance, and posture get affected.
Right, so everything to do with movement gets affected.
Correct, yeah.
But the child can talk, emote, socialize?
No, these also will be affected, okay, since it's a disorder of the brain. Like, for instance, may not have control of the neck, may not have control of the limbs, may not have control of the trunk, or the legs cannot stand, walk, etc.
Unlike the sensory disorders, here the child is having issues with movement, coordination, balance, walking.
You're right. Okay, so in the sensory disorders, the child is walking, running, moving, doing everything. But there are other issues which we discussed in our previous podcast. But here, it's predominantly the motor functioning which gets affected.
Right. So, what is the cause of cerebral palsy?
Well, the cause generally it is before birth. It could be either a genetic disorder where the developing fetus has inherited something from the parents, or it could be because of maternal infections, or it could be because of some metabolic disorders. And there are a lot of children who unfortunately their brain does not function because of lack of oxygen, either just after birth or maybe sometime later in those initial days.
Can you tell us a little more about this? What is this lack of oxygen?
Well, yeah, very, very interesting. I'm sure this has been depicted in a lot of movies as well. The moment the mother delivers the child, the doctor is there or the nurse, the child comes out of the uterus, then the nurse holds the child with the legs and pats the back. I don't know if, I'm sure, it looks as to people start wondering, why is this happening? That's when the moment they do that, the child cries. But when the child is delivered, they cut the umbilical cord. So that connection is lost. Now the child has to breathe on his own. So when he cries, the lungs expand. And the oxygen is restored to the brain. Everything is normal. Suppose the child does not cry immediately, then there is lack of oxygen to the brain, because of which the child's development gets affected.
And during that time, these abnormalities they happen. What
Exactly.
happens in the brain during that time?
The neurons do not develop. Depending on the duration, when did the child start crying, there will be that amount of damage. Like I get children, and what we normally see, there could be a little about 20% of damage, 50% of damage, 60% of the damage. The cells die, they get atrophied, or in technical terms we call them gliosis, where the neurons are not functioning, because of which that particular part of the body does not function at all.
It does not develop.
It is not developed. Like for example, now if I have to move my right hand, there is one particular part in the brain which stimulates and I'm able to do it. Suppose that part is not developed, my right side of the body will not develop. Suppose we get that where the child has like an hemiplegic pattern. Sometimes the part affecting the lower limbs, that area does not get enough oxygen, so the child above is fine but cannot stand or walk. So depending on the area which gets affected, and certain children the entire brain gets affected, so neck down they are like this, they
Yeah.
can't move anything at all.
What about vision and hearing and speech?
Depending on the damage, all these can get affected. There are certain children where it's only the motor. They can see, they can hear, and they can speak as well. There are certain children where even their cognition will be okay. But if those areas get affected, children cannot see. There are children who cannot hear, who cannot speak, and certain children, even their cognition and the intellect also is low. It all depends on the extent of damage.
Yeah. So at the time of birth itself, it is known, right? Because of delayed birth cry.
It can be, I cannot say it is known. Yes, there is a strong possibility that this child will land there. A strong possibility. That is the reason why we get that Apgar score.
Right.
From the hospital when the child is born, the pediatrician, the neonatologist who was attending the child will give the score as to when did the child cry, what was the color of the skin. We have the entire criteria where based on that you can predict to a
Predict.
large extent if it is written correctly.
Right. And what about the time before birth, when the child is in the womb? At that time, the scans, and can something predict?
They can. There are certain disorders, not all. Certain disorders which can be predicted by doing certain, what we call as amniocentesis, the ultrasound. There can be, but not all of them. A few things can be predicted, and the parents can plan whether we should deliver this child or not. But what we were talking about, the lack of oxygen and all, that is after birth. It's just the bad luck of the child.
Yeah, after birth,
Yes.
or even in the initial stages of life?
Yes, in the initial stages also it can happen. Like we spoke about lack of oxygen. Now certain children might develop other problems like neonatal jaundice.
Yeah.
It's very common. And after that, because of that might affect the brain, and child's development may be delayed and retarded. There are certain children who may develop respiratory issue for any reason. It could be the child can have a seizure
Yeah.
and just not able to breathe, and those few seconds or minutes can affect the oxygen supply, and that may also result in cerebral palsy. So it can happen just during birth or after birth because of some other problem.
So, what are the symptoms of cerebral palsy?
Right. Like I was talking in the initial part, to just continue that. When the oxygen supply is there, when everything is fine, then the child's development goes step by step. Now, when this has not happened for whatever reasons which we spoke about, then the child's motor development gets affected. Now, this could present in different forms. Like, for instance, number one, the child may be very spastic. Spastic in the sense the limbs could be very stiff. That is one presentation. The second presentation could be the child does not have any balance and coordination. Or sometimes the child is developing but then has lot of involuntary movements in the body. Child is just not able to control. The mother carries the child, the limbs goes like this, or the mother carries the hand goes the other way. So this is also possible. Or sometimes the child might be totally floppy. The limbs are very, very flaccid, as if there's no control at all. They're made of rubber. Not necessary. All children should follow just one particular pattern. Sometimes they can have even a mix of any of these things. So classically, this is how the child, the symptoms will be there in the case of cerebral palsy.
So, do these symptoms define the types of cerebral palsy? Are these classically the types of different
These are the
CPs?
types. What I was trying to make it in a very simple way. Okay, so this is how the classification is. It's like the first one, what I was talking about, where you have the
limbs
stiffness.
are very stiff.
That is the spastic type.
Spastic cerebral palsy.
Yeah, and the second one was the incoordination. So that will be the ataxic. The third one is where the child has involuntary movements. That is the dyskinetic. And you can also have a mixed type.
And a type where everything is so loose and flaccid.
Flaccid.
So that's a flaccid
Yeah,
cerebral palsy.
correct.
And we can have everything in one child also.
Yes, it is possible. It is possible, and it's quite common as well. Because the child, the fetus will not, or the developing child will not read the textbook and come out, I should choose this direction. You can
Yeah.
have any type.
Any
here.
type. Okay.
And at times that also leads to confusion. And a lot of parents, and unfortunately even the doctors, may not recognize this is a type of CP. This is a symptom. This has to be taken care of.
Do you have an example for this?
We have lot of children who have, like, for instance, if you take the spastic type, where the child's limbs are stiff, a lot of people might just think, okay, this is because the child is holding it, or the child is scared, the child is not responding properly, so let us just do massage and something, and child will become all right. So it can happen that way.
Coming to the early signs of cerebral palsy. Now, I'm sure there'll be some signs which the parents can see when the child is developing. So, what are these signs which the parents should look out for?
This is very important, very important. When after the child is born, there are stages, what we call as the milestones. The child has to reach that particular milestone at that particular age. If the child is born in a city or in a place where they have access to hospitals, then the pediatrician always have that chart where they see the child reached that stage or not, and that's a nice way to monitor. But then, all said and done, what should the parents be aware of? For instance, up to 6 months, what should happen in a child in the first 6 months? One, the child's neck control. The child should be able to hold the head down, up, right, left. When you carry the child should be able to move around. The head should not be floppy. That's one of the most important things which the parent should look out for. If this is not happening
Within 6 months.
within 6 months, Generally, it happens around 2.5, 3.5 months. But maximum they can wait is for, I would not even say 6 months, maybe 4, 5 months. If this is not happening, immediately the antenna comes out, the red flag is on, and they have to start worrying, go and get things sorted out.
Right.
The neck control, and to certain extent the child should also attempt to start rolling there. The next stage is between 6 months to 10 months, which is again very crucial. After the neck control, which we already achieve in the first 6 months, the child should start turning, rolling. When he turns to the side and goes from supine to prone, like lying on the back to lying on the tummy.
Yeah.
Then the child should start sitting crossed legs or sitting with the different on a chair. When you make the child sit on the bed, the child should be able to sit there. 3, the child should also be able to get up from sitting position and maybe hold something and stand. Not only that, when I talk about hold, the child should be able to hold things, reach out for things. If you give him something, grab and take it to the mouth and eat. So these things should have developed. If the child is not rolling, if the child is not sitting, if the child is not trying to reach out, talking about reach out, or if he is not trying to reach out with one hand. Like for instance, this has also happened, which we have seen so many cases.
And asymmetry between the two sides.
The child tends to use only either the right side or the left side and not using the other side. That is also not a good sign. Parents should just not sit there thinking, my child is right-hander, so he's using more right. Or my child might be left-hander, he's using that. He has to use them more or less equal. There are certain things like he needs to grab with 2 hands. Child should be able to do that. So that should happen by the age of 10 months.
10 months. 6 to 10 months.
Yeah.
The child should be able to hold the neck, roll over, reach out for things. There should be no asymmetry between the two sides.
And sit.
Sit independently. Correct. Without falling.
Yeah. And maybe also attempt to stand. These are the motor developments, yeah.
Okay, what about after 10 months?
Yeah, now after 10 months comes the next stage where the child is independently standing, the child is walking, the child is running, holding toys, play, all these things just take off after that. Like I would like to say the child is on his feet now.
Yeah.
Okay, running around and playing. If this is not happening, you will have to get worried and immediately rush, I would say, and try to figure out as to what has gone wrong and how can we fix it.
Okay. So the first check is at 6 months, then 10 months, and then probably at 12 months.
Correct.
Okay. There are times when I've heard parents saying that the father also walked late. So it's okay. Child will walk late because his father started running at 2 years. What about these notions?
Yeah, that's a very, very interesting thing, and I find it so funny and at times get irritated with this because day in and day out we get that.
Yeah.
I get a child and child is 4-year-old, sometimes 6-year-old. Last week there was a child I was talking to you about, 3-year-old child. Both the parents are educated. I don't want to mention what kind of education, what was the thing. And I was shocked. 3-year-old child not moving his neck properly, not trying to reach out.
Very surprising.
The reason given most commonly is what you mentioned. It's okay, we'll wait. The father, the grandmother will say, in our family, everybody walks late. I say, in your family, everyone is dumb. You want this child also to be dumb? That's how I would take it. And they keep waiting. They keep waiting indefinitely. And in fact, let me add here one point which I've been pointing out to a lot of people. At times, even doctors are not aware of it. Some parents go to the doctor and the doctor says, he's okay, just wait for some time. Maybe he'll develop. But then you have lost so many precious days, not even weeks and months, I count in days. So many precious days where you could have brought the child back just like this.
Yeah.
Now the child has to suffer his entire life. Like you see so many, now they're adults, they come and the parents say, can you do something? 18-year-old, 20-year-old.
Yeah.
The patient is on the wheelchair now, completely gone. I don't know, maybe things could have been corrected if this was detected earlier.
So, how often do you see children with cerebral palsy in your OPD?
Every day. My outpatient is Monday to Saturday, and approximately I can tell you about 15 to 20% of my outpatient population is patients affected or suffering from CP.
And what age groups?
All ages. The youngest child I had in my career so far has been 52-day-old child, and the oldest one was 29-year-old adult. That's a huge range, yeah.
Okay, so on a daily basis, in your morning and evening
Correct.
OPD, you see a lot of children with cerebral palsy.
Lot of cases, yeah.
And
And this to certain extent, this is also happening because there were some YouTube videos we had released some time back,
yeah.
mainly because I was just getting bugged by this. Children have an issue, parents are not aware of it. The doctors whom they're going to, they are not aware of it. They keep waiting. So we made 2 videos and released on our YouTube channel, and that has been like the 52-day-old child. They saw the video and they landed the next day.
Okay.
And they said, we want to start the treatment as soon as possible. Yeah, sorry.
Yeah, so the videos have been helping us in creating a lot of awareness around this diagnosis.
Correct, yeah.
Hopefully this video should also do that.
It should. The main purpose is that because these children can be brought back, yeah, not 100%, but to a large extent.
Yeah.
If things can be...
So if the child is diagnosed early, we can bring the child to a very good functional level and improve the quality of life.
Correct.
Like you said, not 100%, but yeah, we can markedly improve the quality of life.
Huge,
of
to a
this child.
large extent. The number of children who are there at Plexus, you must be, you're totally aware of them. How they've come back.
Yeah.
In 2 months, 3 months time, where the parents thought nothing can be done, and they're walking, they're smiling, they're interacting, they're thinking, talking. So many things just come back so soon. That is because of the age. The diagnosis was done early and treatment was started early.
So these parents who bring their children to you, how well are they aware of the diagnosis, and are they diagnosed? Do they come with a diagnosis?
Right. Now the children who come to me, they have gone through the filters and they have gone through the YouTube channel. They have had some awareness. But if you ask me about the overall population which comes to me, it's a mixed kind of thing. There are certain children who have been diagnosed and certain who have not been. Now, even when you talk about diagnosis, there are quite a few children who come, like the SIBs whom we are treating now. The parents were wondering as to why, the brother and sister, what's wrong with them. Once they came here, I ran the entire battery, did the entire process of investigating, and then came to a diagnosis as to these two have CP, what is their cause, and started their plan. And the boy is already better. Although the girl, since she's older, so she will take some more time. So yeah, some of them have got a complete diagnosis, some of them a partial diagnosis, quite a few, they don't even know what's happening. So it's a mixed kind of thing, group.
Okay, so how is the diagnosis done? Now, apart from the early signs and symptoms, now is there something else that will help in the diagnosis.
Definitely, yeah. See, now, the first thing is we know that the child has cerebral palsy. The child's development has been delayed, which we call as a developmental disorder. That is the first part. Then the next part is to know why did this happen.
Yeah.
So, a detailed history can give us an idea. The child after birth just did not cry. This also is a very tricky question, tricky point here, because in India, the parents, like for instance, the father is not there during the childbirth, unlike abroad.
Yeah.
And most of the time, the woman is herself in those pains, she will not be aware. Or if it is a cesarean section, she is sedated and she is not aware of whatever is happening. So they have to just believe what has been told to them. The child cried or child didn't cry. So we know that the child has a developmental delay. We need to find out why. One was the history, which can give us some idea as to this is a possibility. The other things include, like for instance, if the child is premature or if the child didn't cry immediately, the child can be subject to a cranial ultrasound in the initial few weeks itself.
So will that pick up the diagnosis?
Not 100%. Yeah, sometimes there could be, but yes, that's a very nice point you brought it out here. Since I get so many cases where they say we had done an ultrasound was normal. Doctors told ultrasound brain is normal.
Recently we had
Exactly.
two children.
Two children in the month of July we had, both of them where the ultrasound was normal, and when we did the other investigation which I do and I want everybody to do for the kids, for the children, is an MRI. MRI can pick up a lot of things.
Is it safe?
MRI is 100% safe. Very good question, because people think CT scan is safe, X-ray is safe, since those are the older things. Now, MRI is not new. It's been there from 25, 30, 35 years now. We are using it. But people generally are skeptic about MRI. Although
And
they
they don't do it.
They don't do it. MRI is the safest one, number one. Number two, its resolution is way beyond the CT scan. CT scan uses X-rays. MRI uses magnetic resonance. So there's no harm absolutely with MRI. So MRI can pick up the brain abnormalities or the structural damage to a large extent.
What else? Is there anything else?
Yes. And now talking about anything else, there are times when even the MRI may not pick up in the initial, like for instance, the child is 11-month-old, 13-month-old, MRI is normal. It does not mean
The child is normal.
exactly. Last week I had a child where they had done an MRI at the age of 1.5 years or something, which was normal. The child was 3.5 when I saw him. I repeated the MRI. Parents were very reluctant to do, but still insisted, and we found large areas of gliosis or the dead cells in the brain. So a repeat MRI when the child is a little older. So that comes to the imaging techniques, either a cranial ultrasound or an MRI. The other things which are mandatory for these children are, one, a complete metabolic workup to see the child could be suffering from some type of metabolic abnormality. There are a lot, there's a huge list. I don't want to go into that detail.
But what does it mean, metabolic workup?
There's a profile complete where the blood test is done, the blood is taken, and it is subjected to a battery of things which could have gone wrong in the child's development.
Right.
The third most important thing, which is generally neglected or not done, is a genetic screening. All these children should undergo a whole exome sequencing where everything is looked into and we can find out this child is suffering from this genetic abnormality. Now, that gives us an idea as to how much can we plan for this child and to what extent can this child's recovery be achieved.
Yeah.
So, imaging, metabolic workup, then genetic screening, genetic test. This would be the mandatory things besides the history and the developmental milestones. Now, this will give us a diagnosis. Well, guys, Dr. Naeem Sadiq signing off. Hope this podcast was informative. If you have any concerns or if you want me to cover on certain topics, please comment and I shall be glad to help you out. Now, till then, bye bye.